My name is Steve Brzenzinski. I have been a medical malpractice lawyer for a little over 30 years. I deal primarily with birth injury cases, but I do cases of all sorts with respect to medical negligence. I also speak routinely at seminars, perinatal conferences regarding these topics. And one of the topics that comes up routinely in medical malpractice as well as in presentations around the country would be the use of protocols. First of all, protocols have to be evidence-based, so they have to be good protocols. They have to be up-to-date protocols. I think it's also important that the protocols be reviewed by staff members, particularly nurses, where they're mostly applied to. The protocols need to be readily available. The staff needs to be knowledgeable of them, and they must be encouraged and evaluated, in my opinion, as to whether or not they're reviewing them, whether or not they know them, and when updates come out that they are informed of those protocols and make them ready available so they can look at them at any time under any circumstance. They must be evidence-based, they must be accessible, but most of all, a nurse and doctor must be able to follow those protocols, meaning if the protocols are too stringent and you have a protocol in place that this must be done for every situation, and unfortunately, because of the protocol makes it so difficult to make that situation happen in every single patient, you will get criticized at trial for not following a protocol that you cannot follow on every occasion. So you need to have some leeway in your protocols with respect to having the physician and nurse be able to use their own clinical judgment and training in the interpretation of particular protocols. I think it's extremely important that when there is an adverse outcome that we try to make sure that adverse outcome doesn't happen again. Protocols now is exactly one step in that direction, meaning that you are trying to make sure that the nurse or the physician are aware of their protocols, they're following their protocols, they're updating their protocols, they're practicing evidence-based medicine, and you are evaluating their performance based upon that. So that is an invaluable tool to somebody like me who is spending the most of their career trying to promote better care and patient safety to avoid bad outcomes. ProtocolNow, to me, is a great step in that direction to promote patient safety, increase the quality of care, and make sure all of our physicians and nurses are practicing evidence-based medicine.